Hello dear friends, welcome to Navayu Health. So Global Healthcare India is now Navayu Health. We have another case who is basically a case of malunited fracture both bone leg, in which there is deformity, that is a varus deformity, and there is a shortening of 2.2 centimeter and there is a varus deformity. I can show you on the x-ray. If you see this case, so now you can see here, this is right side, then the left side, and this is the scanogram. In scanogram, you can very well judge that there is a deformity in the left side because of old fracture. This is an old fracture and it is malunited, means the fracture is not united correctly. The alignment is totally wrong. Because of that, the fibula is totally out and it is leading to a varus deformity. This is called varus deformity, and because of this varus deformity, patient is also have shortening. Now he is limping, there is a pelvic tilt, and this is leading to pain in the knee joint also, and this is leading to pain in his right side also. So this is a case of limb-length discrepancy with deformity. So because of this deformity, there is a development of limb-length discrepancy. Many times limb-length discrepancy is since birth. So in earlier case, we have shown that there was limb-length discrepancy of 3.5 centimeter, which we have treated with the help of LON method. Here we need to do both the things. First, we need to correct the deformity. After deformity correction, we are planning to go for LON method. We will try our best to go for LON method. Many times, if there is a very old fracture and there is no canal, so then we need to change our plan also. So here we are planning to go for deformity correction first. We will go for the fibula osteotomy and then we will make the cut at the cora. That is, so it is basically the point where there is a deformity intersection, and then we will try to put the LON. And this is how a case of limb-length discrepancy with deformity, where we are going for deformity correction as well as lengthening. So if any of individual who is suffering from varus deformities, both things can be done in one go, that we will correct the deformity and we go for lengthening also. So this is a totally different case where there is a deformity, there is a shortening, there is a limb-length discrepancy, and we are going for both things. So everything is prepared now, and this is his left side and this is right side. We have already prepared everything, and already, everything scrub has been done. So if I feel there is a bump here, this is because of malunion. So, and there is a deformity. If you compare both limbs, there is a deformity, there is a varus deformity. We will go for correction. First we will go for fibula osteotomy and then we will correct the cora. So guys, here surgery is complete. We have corrected the deformity, and this is the LON method. We have fixed the Ilizaro. So you can see here, this is the nail site from which we have entered the nail. First we have cut the fibula and we have done the osteotomy, because here already it was deformed, so we need to cut a piece of fibula, and then this is the site from where we have corrected the deformity. So it is not like normal LON where we usually go for osteotomy at the proximal side, but here because we need to go at the cora, that is the level which there is deformity. So we have corrected, we have made a transverse osteotomy at the cora and we have corrected it. Now you can see the limb is totally straight right now. This is the limb which is completely straight, and we have put the nail also. So you can see here, now you can see here, I will just show you. So this was the fibula. We need to cut this fibula because it was deformed, and this is after fibula cutting. We have removed almost 1.5 centimeter of fibula because it was totally deformed, and then we have entered inside this is the osteotomy which we have made in the tibia to correct the deformity. And once after correction of deformity, we have introduced our nail. This is the point of entry of nail, and we are very comfortably able to insert the nail. Now I will show you one more. Then followed by, we have fixed the nail at the upper side. Like in LON method, we need to fix at upper side. This is an expert tibia nail titanium. We have fixed with 3 screws so that there will be no rotation. The lower end is free, and now this is how we have fixed with the Ilizaro. And 3 ring. Lower one is the dummy. This is the lowest part. The ring is totally centrally placed. You can see here the roundness. So it indicates that there is deformity has corrected, and we have checked the all the AP as well as alignment also. This is how, if any one of you are suffering from deformities, or if you have varus deformity or valgus deformity and you are looking for lengthening also, so the varus deformity can be corrected with the help of this surgery. After 21 years of age, usually didn't get corrected itself, we need to correct with the help of this surgical intervention. When we go for varus correction, you can, in the same sitting, you can also go for limb lengthening. So varus and limb lengthening can be done at the same time, whereas correction and limb lengthening can be done at the same time. Similarly, other deformities like valgus deformity can also be corrected with the help of these things. So any one of you are suffering from this deformity, or if you have limb length discrepancy, means your one limb is shorter than other, which can be because of some infection, or which in your childhood, or it can be because of some injury, or it can be because of malunion, where the fracture has not united totally, or there is a malunited fracture, then also it can lead to limb length discrepancy. Similarly, your height is less and you are looking for limb lengthening surgery, you can contact on the below number. At Navayu Health, we are providing one of the most affordable limb lengthening in India, with maintaining every care. We are providing total comprehensive package to all the patients. We have done femur lengthening, we are doing tibia lengthening, so any segment can be done. So if you're looking for limb lengthening also, you can contact on the below number. Thank you so much.